This triple combination, it's an interesting combination. It's the first triplet combination with TKI in melanoma, and we used BRAF MEK inhibitors like Encorafenib and Binimetinib with the CDK4 and 6 inhibitor, the Ribociclib. So this triple combination was evaluated in phase 1, and then there had an expansion cohort of melanoma patients. In the first part, we enrolled 21 patients with all solid tumor, not only melanoma but also colorectal cancer and some brain tumors. And we found the dosage for the expansion phase in the phase 2. The dosage was with the Encorafenib 200 milligrams, less than the classical 450 milligrams from the combination of Encorafenib with Binimetinib. The Binimetinib was at the same dosage, 45 milligrams, and Ribociclib was given at the 600 milligrams. The data are interesting. Probably we expected more response. Response rate was 56%. Good, but not higher than the BRAF plus MEK combination. Also the progression-free survival was in the expansion cohort of 9.3 months. Again, good, but not like the 11 months from the same phase 1 trial with the Encorafenib Binimetinib and the 14 months from the phase 3 trial Encorafenib Binimetinib. One of the reasons maybe the LDH, the elevated LDH population was a little bit higher in this phase 1. So the patients with elevated LDH were about 43%. That it's a higher percentage in general. We have 34-36% of patients. But probably another important aspect was that from a safety profile of view, we had an increase, of course, of toxicity with the addition of Ribociclib. We had more toxicity. More patients discontinued the treatment. 10 patients discontinued the treatment. The percentage of discontinuation is 21%, and of course this was due to the addition of the Ribociclib. The 4 out of the 10 patients who discontinued for liver toxicity, but also neutropenia, that is a classical side effect from Ribociclib, was another limiting toxicity. The exposure to the drugs was 8.5 months. This probably is the main reason about this data, because you know that in phase 3 trial the exposure to Encorafenib Binimetinib was 16 months, was the highest that we know. Here the half, and probably this was the main reason of this data that were less than expected, I have to say. Anyway, this may be an interesting combination. For which kind of patients? Probably for the patients with elevated LDH. We should explore if in this case that where the BRAF plus MEK in general the performance is lower than patients with normal LDH, and the patients with the CDK2 and A mutation. Because you remember last year when Kisquali reported the data from the Brafenib Trametinib in the Combi D, the patients who showed the CDK2 and A mutation had a worse outcome than patients with wild type. Probably in this patient, the addition of a CDK4 and 6 inhibitor can increase the outcome. This is something that we should explore in the future with this triple combination.